Hello, I'm Gillian Robinson, founder of Healthcare Compliance Solutions. We work with aged care services across the whole of New Zealand, providing compliance and excellence in care support, and we do that through aged care software, which includes benchmarking and policies and procedures, and really everything a service needs to make sure that they are totally on track with providing the best possible care they can and keeping compliance on track as well. Today, we're here talking with Sophie Walls, a podiatrist. And podiatrists, looking for a podiatrist is almost looking for a needle in a haystack, I've discovered. They're quite a rare breed, so you're quite special, Sophie. I hope you realise that. And podiatrists need to be working in aged care services. Because, and this came to light for me even more so the other day when I was talking to my mum. Now, my mum lives in her own home. She's just turned 92 and is getting increasingly frail, but still stubbornly determined. And when I visited, she says, oh dear, she says, I've been to the podiatrist and it's made such a difference. She says, my feet were so sore and I couldn't walk. And she says, he was such a lovely man. And she says, after only about half an hour there, she says, now I can get out and I'm about walking and I don't have that pain anymore. So it just reiterated that sense of how important it is and how it gives independence back to a person and increases that level of comfort. So a really nice segue into our conversation today. So Sophie, I want to hear from you and hear what you do, who you are, and why you do what you do.
Well, thanks, Gillian. So as Gillian mentioned, I am a practicing podiatrist down here in Christchurch, and I've been in private practice for roughly 13 years, and originally starting off in Australia and then more recently moving back to Christchurch, where I come from. Now, I decided to be a podiatrist very, very young in the piece. I was about the age of 7, and I had a personal experience with a podiatrist, and this woman fixed my problems as a young sports person, and I guess she allowed me the freedom to be able to be participating in the sports that I really enjoyed. So from that moment, I was sold, and I was pretty determined to head up to Auckland to train at AUT where the courses run from. And then after having had that training, I was off to Australia, which was a really good foundation. And I've traditionally worked rurally and remotely in Australia, so it's allowed me a huge experience base, and I really valued my time over there. But to come back home and use those skills now in another private practice setting, it's been really good and really valuable.
Excellent, excellent. So thinking about aged care services and podiatry, as somebody who's worked in aged care services for nursing for over 30 years and aged care since 1994, over the years, we've seen the podiatrist come on site and they go off to the side room and they have a clinic and people are lined up and sent in, and you sort of was never quite sure what went on in that room, and it was quite fragmented from the rest of the nursing team and whatever else was going on. And I always wondered about that. Is that how it should be working? What should be
interesting? So I'll speak from my own experience. So the aged care setting is something that I am interested in, and what I've done coming back into Christchurch is I work with an aged care provider in providing a service for their residents. Now, I've made a very conscious effort to become a part of their team, and I think in terms of when I go into the facility, I am open, I am inviting, friendly, and I really make that effort to engage, because then I feel as though when you are shuffled into the side room, it doesn't isolate you. And I think that's something that I've really, really worked hard at allowing really open discussion around residents' care, and I'm very big on not having a line of residents waiting for the podiatrist. I think this is something that often residents look forward to, and it's something that we shouldn't underestimate as clinicians. This needs to be treated like, you know, their special thing for the day, you know, someone external to them, that's not a family member, that's not a carer, coming in and giving them some attention. Because often I would imagine when you are a resident in facilities, you can sometimes get lost in who you are, and I'm sure giving them that sense of being in control or going to an appointment, that could mean so much for a resident. So that's how I definitely approach when I walk into a facility. I'm very much 100% invested in that facility at the time. I engage. I'm very proactive in talking with the manager every single time I walk past her door, and I feel the more you give in these centres, the more you get back. And
absolutely.
Then also staff really respect you. So if you are generally interested in, you know, the carers, the cleaners, the nurse managers, then what you get out of them is so much more. If I go to a facility and if I feel tired and if I've got 150 other things on the plate, residents pick up on these things, you know, and also staff and their family members. So you pick how you want to approach it, to be perfectly honest. You go, I'm going in, I'm 100% committed, because, you know, that's not only a reflection on us as practitioners, but it's also about advocating for our profession, you know.
So you talk about advocating for yourself as a profession, and one of the things that I just want to clarify, that the qualification to become a podiatrist is actually a degree course, isn't it?
Yeah, so it's a 3-year degree course, and you can only do that up in Auckland at AUT. It's a Bachelor of Health Science, and you major in podiatry. And there's a huge amount, I think there's 1,000 clinical hours within that 3-year course that you do within a clinic at the university. So in terms of exposure to patients and certainly their, you know, understanding the complexities of medical histories and things, it's an incredibly intense and comprehensive course. And it really does set a standard of how one should be approaching their patients when they are in when they're visiting a nursing home or aged care centre. Yeah. Excellent.
So that leads me on to the next question, really, which probably you've touched on already. But if we can break that down into sort of some practical terms, and discuss the difference between somebody coming in that's not trained and doing foot care and a podiatrist coming in. What are the differences that people will see between those two, and why would people use a podiatrist versus somebody just coming in that's not qualified doing foot care?
Yeah, so I guess when I first assess a patient, I'm looking for a number of things. I'm looking at their medical history, so I'm taking into account and I'm scanning my eyes over their medical notes in terms of their medications. That really does tell you a bit of a story as to what's going on or what they're having to deal with on a day-to-day. I'm looking for just, you know, more highlighted issues around their health, whether they have vascular issues, or whether they've had anything like neurological issues like strokes or Parkinson's and things like that. So that's what I look at initially. And then I'm very fortunate in the fact that residents are accompanied by a registered nurse when they see me. So the nurse, I'll definitely have a conversation around the resident that I'm treating in front of them, and then we'll touch on any concerns that they have, the nurses, or whether or not their carers have picked up on any concerns. So that could be that a particular resident has a pressure injury on their foot, and whether or not a foot cradle should be organised for their bed. It could be around their footwear. They've noticed a hot spot within their shoes or on their foot, which presents an area of concern. So we'll have a discussion around this in front of the resident, and then I'll do a further assessment in terms of their skin condition. I'm really looking at the integrity of their skin condition, whether or not they have any sort of frail or broken skin, areas of broken skin. I'm looking at their foot structure. This tells me a lot in terms of, again, those hot spots, high pressure areas, potential issues around footwear, and then I'm looking at their vascular. So often when residents are in these sorts of facilities, they do have vascular issues just naturally that occur with the aging process. And I'm also looking at their neurological status. So whether or not they have peripheral neuropathy, whether or not they, in terms of that, you know, what sort of footwear are they wearing, whether or not they're using a walking aid. So I really do paint the picture in terms of their overall health. And then in terms of foot care, I'm looking at how we can manage some of those highlighted areas of concern from having gathered that medical history and doing the objective assessment. So what that may involve is, again, advising the nurse on how we can manage this patient, also how we inform the resident's family members. So if someone needs a new pair of shoes, what I can do to assist that, to ensure that they go into something appropriate and make sure that they don't then become a further falls risk. So it really is a multifactorial and approach when we look at managing a patient. And again, I'm very much on board with educating the RN or the nurse manager at the same time as I'm treating, and I'm constantly talking. As I'm assessing, I'm talking to the nurse or the carer who may have brought the resident in about what I'm seeing and why I'm seeing something. So typically in this setting, we may see someone with very disfigured feet. The structure of the foot's changed, which can then lead to, you know, multiple issues around some skin breakdown. Cellulitis is a huge issue when we're unable to dry in between our feet properly. So I really use this time as an education session, and I think that's also what I commit to when I attend to an aged care facility. I don't just simply, you know, go in there with one thing in mind, clipping people's toenails. It's totally an encompassing service.
So that's really interesting, because I think that the bulk of the sector certainly are probably not aware of the clinical component, the extensive clinical, comprehensive, physical and medical assessment that you're incorporating into going in there and interacting with that resident, and, as you say, quite engaging and interacting with the clinical team. So you certainly become part of that multidisciplinary team involved in that person's care, because of course, you know, if people's feet, as my mum quite clearly pointed out, if their feet are in good condition and being looked after properly, then we've got limiting the falls risk associated with pain and discomfort and things like that. So, you know, that keeping their independence.
And I also think that the staff really value that education, and therefore we're better off educating and upskilling care staff and their nurse, you know, the nurse manager and the RNs on board within that facility who really know the patients. Then so that's where I see a huge part of my role is. I know that podiatrists are really thin on the ground at the moment, so I do see that in terms of how we can sustain our profession and add value to what we do in this sort of setting. I see that as definitely a big part of what I do. I mean, in terms of how often I visit a facility, sometimes facilities are only visited by a registered podiatrist once every 6 to 8 weeks.
Yes.
I'm lucky. I'm on I visit once a fortnight, and I keep my patient numbers to a minimum. So I would typically only see 8 patients a time. That's a choice that I've made in order to commit and give a quality service at the time. And I come with energy, and I think that's really, really important.
It's quality, not quantity.
Exactly. And I also, I really do my best when I talk about education and providing support. I'm very much, I do in-services every 2 or 3 months around an aspect of foot care and why we do what we do in this sort of setting. And
so just tapping back into that, the education sessions that you do, are they with that specific site?
Yes.
Or are people able to access you for education that don't necessarily currently work with you? How do people get hold of you? Because as we acknowledge, there are not enough podiatrists for the demand out there.
Yeah.
It's very rewarding, as you've said. Clearly you get a great deal of enjoyment from the interaction with the resident, as well as the technical clinical skill that you're applying to your trade, as it were.
So what I have done is I run in-services with the current facility, but I certainly don't see that as being limited to. And I think if we are going to change how we're perceived in these facilities, this is where we as podiatrists need to step up and say we can actually support. If you don't have someone on site or available as frequently, you may be isolated or rurally remote or what have you, there is support, and I think it's about how we can maybe provide educational resources and, again, in-services and even consulting. How we could be on the end of the phone. I mean, it's amazing what we can do through Zoom, photographs, things like that. We need to use technology in this setting. We can't afford not to if we've only got limited numbers coming through, and with an aging population and with more and more chronic disease issues and things like that around diabetes, Parkinson's and things. This is where we need as a profession to step up and say, well, how can we adapt? How can we modify how we practice to still provide a service? Definitely.
Absolutely. Look, Sophie, this has been very interesting, very enlightening, and I'm sure a lot of aged care services will, people working in aged care services will look at this and thinking, wow, I had no idea that that's actually what podiatry is. Where can people get hold of you if they want to continue or enter into a conversation with you about education or getting your services, or remotely for a lot of these rural sites, as you say, they don't necessarily have people within their region, can use technology. Where do they get hold of you?
So they can contact me directly via our email address, and I will give you those details for you to post with this clip. But absolutely happy to have Zoom conversations and really do my bit for our profession in this arena, because we need to really step up when we see this potential shortage coming through. Also, I think just on another note, when I come into these facilities, it's a great opportunity to talk with families and advocate for our profession by talking with families and then getting them to understand a little bit more about what we do within the setting, and the fact that we're not the beautician. We certainly we do come with a skill set that sets us apart, and we are a vital part of that multidisciplinary team that makes up aged care. And I'm excited because I feel as though having this conversation, it will really, we just need to up the ante.
Absolutely. We need more people coming in and doing the training. It's a shame the training is only done through Auckland at the moment. It would be nice to see it in other centres. But certainly, hopefully this opens the eyes of people out there that are looking for maybe a career change or taking on a new skill set. And
it's a hugely rewarding profession. And as I said, I've been doing this for 13 years now, and I never come to work not motivated. And the fact, particularly when you're dealing with people in older people, the smallest things can make a big difference, and to give them that sense of control back that they may have lost through various circumstances or what have you, it's really empowering. And it's a very rewarding job, and I love it.
Excellent. It's great to see your passion, and I'm sure the people that you're working with absolutely appreciate it. Thank you so much again, Sophie. I'm sure we'll talk again in the future.
I'll give you my details, Gillian. Thank you so much.